Hi and welcome. This is Alice with the Mount Pleasant Holistic Chamber of Commerce. My name is Alice Emerson, and I am here with Neda Smith and Dana Pappas, and they're with Gut Harmony in South Carolina, right? GutHarmonySC.com is the website, and they are here to talk to us about our gut. And I love to title this, you know what, my gut, I'm working on it, because it is a constant work in progress. So real quick, I want to introduce you guys. So Neda Smith is a certified colon hydrotherapist and functional diagnostic nutritionist and a co-founder of Gut Harmony. She's completed multiple advanced studies in the area of intestinal gut disease and other gut-related autoimmune disorders. So Neda, thank you so much for being with us and sharing all of your experience and your passion for health and wellness, obviously naturally through, cleaning up the gut. And Dana Pappas is a licensed acupuncturist whose expertise is holistic nutrition and digestive health. She holds a bachelor's in health policy from Penn State and a master's degree in healthcare administration from the University of Minnesota. Her second master's is from New England School of Acupuncture and Asian Medicine. So thank you, Dana, so much for being here as well and sharing with us, again, all of your education, your experience, and also your passion for true health and wellness. And the focus, obviously, is the gut. So our gut health, I know I can't help it. I've heard the gut talked about so much as the other brain or the second brain. And so can you dive into gut health, but will you please address that for me as well, please? Because I think we need to know how important this is.
Well, and there's the word gut it's in so much of our language, your gut instinct, your gut feeling, the second brain. And so it does come up repeatedly. And then of course we have all the other puns that we hear often because our work makes people think of other things related to digestion. But first I just thought I would describe, let me start real basics. What is your digestive tract? And it's really from your mouth to your stomach, your esophagus going down, your stomach, your small intestine, large intestine, anus. And so that whole tract, each area has its own microbiome, which we're going to talk about in a minute, and each has a really important function and an important pH, an important role in making you absorb your nutrients from your foods and get those nutrients to the right place. And that's really what it's about, and getting things that are not right for your body out. Okay, so it sounds overly simple, and it has a great deal to do with our lifestyle, and that's what we spend a lot of time on with our patients, is the lifestyle piece. But it also has a great deal to do with how we're feeling, how strong our immune system is, how well we sleep at night, and probably most importantly, how likely we are to get a serious disease later in life. And I'm sure many people have heard the adage, all disease begins in the gut. And it is true, which is why Neda and I chose to do this business. It was both our passion, and having both worked in functional medicine for quite a while, we kept seeing, goodness, if you really get that gut health humming, a lot of other things fall away, or at least become so much more manageable. So that's what helped us both embark on this journey. Neda, did you want to add to that piece?
Well, yes. Well, thank you for having us, by the way. Yes, the one thing that I think I want to add in there is that also 70% of our immune system is in the gut. So being that right now we're in this pandemic and talking about our immune system, I just want to make sure that everyone recognizes the importance of it, of focusing in that one area, because it really means a whole lot about the entire body. So it's not just the gut. That gut really does so much for the entire health of the body. And being that 70% of it is derived from that area is just, which is really why we wanted to be in the business of the gut, because all disease begins there, but so does all health.
That's beautiful. And it's true. All health begins in the gut. And I really became a personal witness to this when I did a whole detox last year. And I did it with, this other approach, but it did include enemas and clearing out the gut and seeing mucus coming out of everywhere. It was just amazing on how, because I had a cancer diagnosis. It was all precancerous, but it was rapidly growing. And so the surgery was, suggested, and radiation and chemo to hurry up and do that. And we decided that, I had decided to go ahead and create such a healthy environment that disease could not exist. And that included cleaning out the gut. And I, I was in Costa Rica when I decided to go through my whole cleanse and everything. So I didn't have your services with me there, right? But I did, some other practices that include some of the things that you guys are so skilled and so knowledgeable about. So I'm really excited about, how true health really begins there. But a lot of things cleared up for me by cleaning out my gut, and it was a huge part of the puzzle for true wellness. So I love being able to take that icky discussion of looking at your, stools, as a measure of, health, so I love this conversation. And so Dana, I'm going to let you take over on, really, why it's so important, or, wherever you want to lead from, but, just
Well, let me piggyback off
start.
something you just said. In Asian medicine, we talk a lot about how your stool is hopefully your daily report card if you're having a daily bowel movement. But we want to know details on what people's poop looks like. And let me just tell you what it should look like so you can know what we're looking for when we're talking.
A kid will be glad to tell you all about their bowel movements and what it looks like. They'll take a picture. So where do we go from that kid being so proud of, or, whatever, to where, as adults, people don't want to talk about it. And it's such an important discussion. So go ahead, tell us how many times and what it's supposed to look like.
There's no such thing as TMI or taboo in our office. Among each other, we all know each other's bowel habits because we're all helping each other get healthy and strong. So ideally, we'd like to see someone having 2 to 3 bowel movements a day. You should not be having any really gas or bloating after eating or at any point during your day, minimal gas right before a bowel movement. When you sit on the throne, as my grandfather used to call it, you should have a bowel movement pretty quickly. There shouldn't be straining, it shouldn't take a long time, shouldn't be pain. And when it comes to cleanup, there should be almost none. Your stool should be formed one piece, smooth edges, medium to dark brown, no little balls, not really thin, not orange tinged. That tells us the transit time's too fast. That's usually due to a food sensitivity or an infection. The little balls is related to constipation and sometimes a liver component. So, and on the other end of digestion, we shouldn't really see burping or reflux. For some people, that's just become part of their norm after they eat hot Tums. That's not normal. A healthy digestive tract, you're barely burping at all unless you have carbonated drinks or something of that nature. So that's our gold standard, what we're helping people get toward. And those symptoms mean a lot to us. And when someone's having gas and does it have an odor, and all those things mean something. So that's part
I'm glad you brought that up right in the beginning, because if somebody's watching, somebody's listening, then they know right now that they need to listen in for a little bit longer. And you guys are going to be with us to really, expand on this, because I doubt most people go, I know very few people that go 2-3 times a day.
Yeah.
I mean, in this day and age. So not that we all talk about this, but
we expect that from babies, right?
Mm-hmm.
And yet for some reason, we lose that knowledge as we age, and we suddenly think for some reason the digestive tract has changed and you don't need to have those frequent.
So you can go once a week, or some medical doctors, well, I don't know when they decide that it's chronic constipation. I think people aren't going, is it 3 times a week or something?
Doctors will usually say if it's been more than 3 days, then that's constipation. Well, if you think about, Ned always says that's 9 meals that are
And no snack. That's not even counting the snacks that people have, right? Oh.
And that's just ridiculous. And there's a lot of things that contribute to constipation. We get that question often. What can we do for constipation? And there are so many things, and we can talk about that today if we have time and people want to get into that. But one of the things that we do, we don't get people generally coming to us because their digestion is perfect. We do get some people who come who are doing cleanses and want to use our colon hydrotherapy services. They do have very healthy digestion, but they're doing a cleanse, or they're preparing to get pregnant and they want to do a detoxification, and they use our colon hydrotherapy for that, which is, actually, Neda, do you want to just describe colon hydrotherapy real quick?
Sure. So colon hydrotherapy is infusion of water into the colon. And how it differs from doing an enema is that an enema, typically we do about a quart of water only. So that only gets to the very bottom of the large intestine. But with a colonic, we are able to infuse much more water than that. And when there's an elimination that happens, it goes through the tubing and out into the sewage system. There's no need to get off of the machine or off the table or off the floor if you're using an enema and go and sit on the toilet. And then once you do sit on the toilet, that's the end of the enema. But with a colonic, you can infuse water, eliminate, infuse more water, and eliminate. So you really can get anywhere from 10 to 20 enemas in just one session. And the large intestine being 5 to 6 feet long, depending on the height of the body, is where, will dictate how long your large intestine is. It's, it is also 1 inch in diameter. So that can really hold on to a lot of stool. So that's where it's so important that you want that water to go in and soften the stool that has gotten caught in the body, and be able to flush it out and send in more water and keep doing that over and over again.
Thanks.
Is that painful at all to do that?
No, I know a lot of people seem to think that. It is one of the fears that everyone has, is the pain that's going to be associated with it. There is no pain. There is maybe a slight discomfort because, yes, there is something inserted into your bum. The muscle is supposed to be things coming out and not things going in. So yes, there's a slight discomfort, but it only lasts for about 15 seconds, that discomfort. And then you just feel like something's there, but it's not an uncomfortable feeling at all, or a painful feeling, I should say, at all.
Okay. I just had to ask. And 15 seconds is nothing.
Yes.
Yeah, that's nothing. And if you don't mind, I mean, I just have the fact that you said that's 1 inch in diameter is just amazing to me, because that can hold a lot around the wall of
Yes.
the intestines. And so just the thought of this is going through my mind. I'm a visual person, of it, like kind of cleaning that out actually sounds like a fabulous thing for me, because I guess you guys will get into this about how it needs to have a clean cell wall there, like, intestinal wall, so that nutrients can be absorbed well. So I can imagine people who are having problems eliminating that, maybe they're not getting the absorption of all the nutrients and everything else that's, supposed to be going through with the food and the supplements, if that's what they're taking. So I love
Absolutely.
the idea of cleaning it out.
Yeah, and I'll let Dana talk about the absorption piece, but the other piece that I want to mention too, because as we have a lot of people who come in through cleanses and detoxification, you have to have the pipes clean to be able to dump and detox and cleanse the body. And if you don't have those pipes clean, literally, if you don't have them clean, when you are doing a cleanse, let's say, for example, a liver cleanse, you're releasing all of these toxins, but where are they going if the bowel movement is not happening? So you're releasing all of these toxins, and then it's being reabsorbed back into the system. So that's why it's always so key and so important to first start off at the bottom of the pipe. As Dana mentioned earlier, from the mouth to the anus is all one big tract. So it's so important to start from the bottom of the pipes, make sure that area is clean, and then you work your way up in the cleansing process and so forth, so that everything can be cleansed out of the system as well as be absorbed. And I'll let Dana talk about that part.
Well, yes, and speaking to that, so Neda is the one that oversees all of the colon hydrotherapy, and I oversee the microbiome testing and treating the microbiome. And we have a patient, which I'll talk about in a second, but when an infection comes back on that microbiome test, that's one of our first recommendations typically is colon hydrotherapy. Because before we go in there and start addressing an infection in the GI tract, which is going to release a lot of toxins through die-off when we're killing it, which are going to be very pro-inflammatory to the body, we want to clean that colon first so that when those toxins do reach the colon, they go right out. So that is a key tool we use in treating infections. And when we do that successfully, we see the patients heal so much more quickly, and they won't get the joint pain or the headaches or all the things that we can associate with die-off. They recover much more quickly. So it's—
When you say die off, just because I'm not in your office and I'm not in this field normally, so you're talking about when you're starting to kill infections or detox or like even these viruses, right? That we're getting rid of these things out of our body. That's the die off.
Right, when we're addressing an infection that comes back on a test, exactly. Parasites are a big one. So let me tell you, so what we use a couple different companies for stool testing. That's how we look at our microbiome. So your microbiome is the collection of organisms, living organisms in your gut, and we have them everywhere. We have a microbiome on your skin and your mouth. But your large intestine, which is truly what we mostly are referring to when we talk about gut, has its own microbiome, and that's where your colonies of organisms is supposed to be the most robust. Now, we do have a microbiome in our small intestine also, and that's where the majority of nutrients are absorbed. And then going up to your stomach, we really don't have a microbiome in the stomach because of that acidity level. That's not a welcoming environment for organisms to live. But up into your stomach is where the most of your proteins get broken down. And then if we go up one step higher into your mouth, that is where your carbohydrates get broken down. And that's really an important, as Neda says, we start at the bottom, we work our way up, except when we're dealing with food sensitivities and food allergies. And I'm going to get to that because it's such an important piece of this, or food intolerances, I should say. But the microbiome in the large intestine is what we're testing when we're doing stool testing. And so we're looking for all the beneficial bacteria. Now, there are hundreds and hundreds of types of beneficial bacteria. The stool test is getting a snapshot of the most important ones. And it will also give us a snapshot of opportunistic bacteria, which are bacteria we all live with, but when they overgrow, they start to act like a pathogen, meaning that they start to act like an infection, causing a problem. And the stool test will also look at true pathogens, so parasites or H. pylori, which is a bacteria that can live in the stomach and the upper area of the small intestine and can cause a great deal of challenges because it's at the top of your digestive tract. So everything from there down doesn't work well when you have an overgrowth of H. pylori. And we are also looking at acute infections like salmonella and giardia, those types of things. For some people, those become chronic infections. And that's getting back to the point Neda made at the beginning. Infections are so important to identify because a few reasons. One, they're greatly impacting your ability to break down and absorb nutrients, which impacts everything else in your body, your energy, your ability to sleep, your ability to think, your ability to perform in your day, your ability to be patient, your ability to communicate effectively, remember things, right? So all of that is being impacted. Then secondly, your inflammation. And truly, you know, kind of our new understanding of disease and prevention of disease, especially in this autoimmune world that we now live in, it's managing inflammation and preventing inflammation. And one of the key ways we can do that is understanding what's happening in your microbiome and balancing it in a healthy way.
Go ahead, I'm sorry. No, I was just going to say, microbiome, like I understand, you know, we're, like you said, we're just a walking microbiome, right? Mm-hmm. But can you just put that in simple terms for maybe somebody who's never heard what microbiome means.
Yeah,
And
that's what I was saying. It's the good bacteria, that opportunistic bacteria. It can include parasites, which we don't want it to. It can include viruses. It can include fungal overgrowth. So it's all the living organisms that are on and in us. We're particularly talking about the gut microbiome right now, but the microbiome are so key for the immune system function. When Neda was saying, why is the majority of your immune system function in your digestive tract? It's because of these organisms.
okay.
We have more bacteria cells than we have human cells. So we are more bacteria than human, which is.
And it's not all bad, right? Everybody wants to kill all this bacteria, and we actually need a healthy
can't live
balance,
without
like you were
them.
saying.
We are a mess. In fact, when I get a test back that has a lot of infections, I go, okay, we've got this. When I get a test back with someone who has very little good bacteria, sirens go off in my head. Say, okay, all hands on deck. We have to fix this right away. So not that I'm ignoring infections, but that makes me more nervous.
Okay.
You don't
So
have
you're talking about getting the test done. So tell me, like right now, offices are closed, right? And so how would somebody get a test, and what does that look like to do that? Because some people are, afraid to even talk about a stool or a bowel movement. So now we have to test this stool. So how is that done, and can it be done even like now, even though the office isn't really open for seeing patients?
Yes, great question. Well, fortunately, we were able to transition very easily into telemedicine because it's something, we have patients all over the country. So it's something we were used to doing. And the stool test gets shipped directly to patient's house. You do it in the privacy of your home. They give you, if you're from up north and you used to go out to the clam shacks in the summer, they give you these little baskets that look like you always got your clams in, and you capture your stool in that. And then you just take a little sample in this jar they give you, shake it, label it, and FedEx will pick it up and take it back. And so super easy. It's just one sample. If you have a really difficult time having bowel movements, we can also send something to you to help have a bowel movement so you can get the test done. And then we're reviewing all of the lab results over the phone and finding creative ways to get people their supplements and protocols to start treating the microbiome imbalances we find. So it's pretty effortless, except for having to,
simple,
which
so
you already hopefully have to do.
Yeah, so simple, nothing to be afraid of, right?
No, not at all.
Very private, but so telling. So the test is just very revealing about your true state of health, right?
It is, because in addition to giving us that snapshot of all those organisms we just talked about, is there a candida, a yeast overgrowth? Is there chronic Epstein-Barr in the gut? Is there, salmonella? And we can trace back and say, oh, it looks like this person may have been exposed to salmonella toward the end of February. We can, look at it and see all those things. Is there enough good bacteria? Is it they're imbalanced? Sometimes there's a real overgrowth and a real deficiency, and we know how to do that. But in addition, we can see how the organs are functioning. So is the pancreas making enough digestive enzymes? Digestive enzymes break down all of the food. So if you eat a piece of bread, those digestive enzymes break it down into a carbohydrate. Your cells can use a carbohydrate. Your cells cannot use a piece of bread. When you eat a steak, your cells can't use a bite of steak. It can use all the amino acids, the protein that it breaks down, right? So that's what digestive enzymes do. And same thing with lipids from fats. So the fat has to be broken down. And so the liver and gallbladder are key organs in creating the bile salts and the enzymes that will help break down the fats. And that's so important to know about your digestive enzymes and whether you're making enough of them and they're being released into your food, because if you aren't breaking down those foods into your amino acids and carbohydrates and lipids, that's where we start to see food sensitivities and food intolerances. And when we have those, and especially, if you've ever met that person who they're down to a list of, 10 to 20 foods that they're able to eat without feeling gassy and bloated and uncomfortable. That's pretty severe advanced inflammation and food intolerance level. So we look at that as calling that oral tolerance. We need to repair the whole process. It's not a matter of just removing foods that you can't eat. Eventually you can't live on air. You have to eat. So
Yeah.
you have to solve the reason why those foods are not being tolerated. But the other things on the stool test that really help us, we can look at some inflammatory markers. So to measure how inflamed the gut is internally, we can tell if there is a reaction to gluten within the gut. And I can guarantee you, if you're reacting in the gut, you're having a systemic reaction to the gluten. And we can look at how your immune system is doing. It's really alarming to me when someone has 2 or 3 infections and their secretory IgA, which is the marker from their immune system, is really low. Because that means their immune system, means those infections or infection has been there a long time, and their immune system is so fatigued. And why that's so important is because what if then something else comes up, like cancer cells, which we're all getting every day, right? It's the immune system's ability to gobble those up and prevent that from continuing. What if something like a corona or another, very serious thing that we're exposed to, your immune system's not online because it's been so tired trying to chase after this other, chronic gut infection. Or yeast can do that. H. pylori, that bacteria in the stomach, can do that to the immune system over time. Serious food sensitivities over time can do that to your immune system.
I like the way you had just said that about, let's say something like the corona or another virus comes along and the immune system is just tired. Like, I think if you really think about the body and really, think about the immune system and take it personally like that, it just really makes you that much more in touch with wanting to care for yourself and take these tests and take care of your gut and give your body and your immune system, it's the best fighting chance that it has to really be strong and not constantly overworked with things that are unnecessarily being overworked, that it's unnecessarily having to fight.
It's a distraction.
Right.
It's a distraction.
Yeah,
And that is how I think of it when I'm treating it, because your immune system's still there. It just is truly fatigued. It's worn out from chasing after these little fires that are distracting it from what it really wants to be doing, which is helping preserve your wellness and your health. But instead it's constantly being pulled down into this noise. And so that's one of the beautiful parts about looking at the stool test is we can identify what are those things that are distracting and fatiguing the immune system. We can also see if you're breaking down and absorbing fats, which tells us a little bit of how the liver and gallbladder are functioning. It can tell us if there's any blood in your stool, which is more alarming and can tell us, do we have a more serious problem like irritable bowel disease, Crohn's, colitis, something like that. If we combine that with, there are certain bacteria, this is so rewarding. We've had several patients that we've caught before they were symptomatic, developing Crohn's and colitis. And they had too much blood in their stool, their immune marker was too high, and that a really high amount of this certain bacteria we often see associated with those diseases. But they were still not symptomatic. So we were able to get in before these diseases had fully blown and turn things around. And that's just so rewarding to me. That's true.
That is rewarding. Right, because if you can catch it early and then, some people don't even know anything's going on and then all of a sudden they're ready to retire and life is supposed to be good. And then all of this tired system is now starting to become symptomatic. Or, it could even be younger, but yeah, people just don't know what they don't know. And this test is the testing and the things that you're identifying is different than the blood work because a lot of people will get their annual blood work. So how often do you suggest this type of testing should be done? Is it an annual type of test?
That ideal digestion I talked about, yes, I would love people to do it annually and just keep working on. Like your opening quote, what? Gut, I'm working on it. If you've had years, and because it's a taboo topic, and because it's something that doesn't usually happen overnight, we don't get a sick gut like that. Usually these things are insidious over time because of lifestyle issues. And we don't realize, and we're not talking about, but what does your poop look like, Yeah,
I usually don't walk up to people, hey, how you doing?
Right, you don't know. You don't know. And so, you know, Ned always, I think, gets embarrassed for me when I tell this story, but I was many, many years ago, early on in my journey with this, and I walked into the women's room and the woman before me did not flush. And she had had a bowel movement. And I'm so grateful to whoever that stranger is, because I took one look at that toilet and I thought, what goddess left that there? My body couldn't do that. And it was the wake-up call that something, I hadn't had a stool like that in a very long time. And so it was a real call to action for me, and making me realize something was very wrong, but it had happened so slowly over time that I didn't realize. And I had celiac disease and I didn't know. It took me still many years after that to find out that that's what was wrong. And celiac disease is when if you eat gluten, your body will start to attack the inside of your small intestine, which is where you absorb all your nutrients. So it's a disease of malnourishment, among many other things. And so because again, you're not discussing, you're not sharing your stool with other people, but thankfully this lovely lady forgot to flush, and it was a big moment for me.
Neda, do you get embarrassed by that story?
No, I don't get embarrassed. It's yeah. I mean, I've even accidentally, Dana's even walked in on me because I forgot to close the bathroom door. That's probably more embarrassing.
Right. That's so funny. No, but I mean, that's very interesting because people just don't know, because this isn't a common conversation. It's not even one that I think in the years that I suffered from, not being able, to go on a regular basis, that my doctor ever even discussed with me, ever. Like, what does it look like? Is it sinking? Is it floating? Is it not? Like, there was never that discussion. So I love that you're having this discussion, and it's not embarrassing to me, and I hope nobody watching was embarrassed, because it's a fabulous discussion to have, because it is a state of health and or not health, right? And then being able to have full absorption, like you said, with celiac disease. Let's talk about like the absorption, and the nutrients, and why it's so important to have this microbiome so balanced.
Right, and just wrapping up that last question, how often do you get the test? We test as we're working on the gut every 3 to 6 months until we're where we want it to be with someone. And then I love people, again, if they're slipping or it's not working well, then it's something that should be done every year, every other year. Like you said, you get your blood work done, and blood work is so important. It's wonderful when we get someone who has had blood work done and we can compare. But remember, the blood work, getting to this question about absorption, is the result often of how your digestion is working, because that's going to direct all these other organs. They work, as a result of a lot of inflammation in the body, or nutrients, good nutrients or lack of nutrients. So a lot of what we're seeing in the blood work is a result of what's been happening for over long periods of time in the digestive tract, among other things, obviously. But so nutrients, so right. So if anybody wants to leave this with one thing in their mind, it's the ability to break down nutrients and absorb it properly. That's what this is all about, right? So one study showed that if you just do 4 things before you eat: you look at your food, you smell your food, you think, I'm really excited to eat this, and it has to be true. You get to lie to yourself on that one. And you have feelings of gratitude. So the things that we do during saying grace, for instance, right? Taking that moment, that will increase the secretions in your stomach that break down your proteins by 20%. So before food has even touched your mouth, you can start improving your digestive tract just by taking it.
It's amazing. The body is an amazing, like,
it is
complete organ, like biome, whatever you want to call it. I mean, it's just amazing how it all operates. Yeah.
And it continually asks us to slow down and be present, right? It doesn't work well when we're eating, through a drive-through and the protein bars that we're not paying attention to, it doesn't work well. Now, we all have to do that once in a while, but when that becomes the norm is when we see the problems. And we're in a culture where that is normal. So it gets a little difficult. You know, people always say, oh gosh, you know, how do you do all these things? I say, it's what my grandmother did. And I spent a lot of time with my grandmother. And I just try to have a kitchen like my grandmother had. And I live a lot like she did. And it's not new agey, it's not modern, but it is bucking the system, because that's not how society, it was easy for her because that's how society was. You know, all your food was local and it was organic. They didn't use that word. And she knew the butcher who raised a lot of the meat, and it was her cousin. And, you know, it was just different. There was no microwave, there was way less food additives, all of that. So just having that awareness of keeping it a little more simple, being present when you're eating, chewing, and then making sure you have a healthy stomach, which sounds so much more simple than it really is, because very few people do have enough stomach acid to properly break down the food into those amino acids. Remember, every food has protein. So every food has amino acids. And if you don't have proper stomach acid, you can't break your food down into those amino acids, which means your small intestine, which is the next stop for your food, right? The small intestine can't absorb it. So now we have things that your immune system, getting back to Neda's saying, you know, the importance of the immune system's tagging these things as foreign. You've got these dendrite cells on the outside. You know, if this is your small intestine, you've got dendrite cells hanging out here, and they'll reach in to the small intestine and they'll kind of grab stuff. And if it is something that it doesn't recognize as food, like an amino acid, then it sends off the signal to the immune system. So now again, we've got the immune system chasing down all this stuff and being distracted, right?
I'm sure there's a lot of things in our food, the additives and such, that the body does not recognize. And
I was just going to say, then you add the level of toxins, correct? Food coloring, big one. I mean, I am just forever, I'm sure I drive the teachers crazy in the schools because I know they're working so hard and doing their best, but I write it on every sheet. My kid cannot have food coloring. My kid cannot have food coloring. It is such a big deal. And especially in children where those nervous system is still developing. But yes, so the glyphosates that are sprayed on certain crops, especially wheat, and that's where a lot of the gluten is already a protein that's really hard for the body to break down into those little amino acids. And then you add to that glyphosates that are sprayed onto it. And now we've got a protein that is just inflammatory for a lot of people.
yeah, I'm sure that's why we've seen such an influx of all of the autoimmune and inflammation and, you know, those disorders. Yeah, I saw Roundup is still for sale. I was at Lowe's today, so I just find that amazing. Yeah.
We still have farmers doing the monocrops and the GMOs and the spraying, and yeah, it's.
Well, you had said, like, especially with children and their brains are still developing, and we talked about this being the second brain, the gut being the second brain, right? And so a lot of times the gut health can actually affect the thinking and the ADHD, or, you know, the brain fog that a lot of people have is because of this whole absorption as well as the toxins. So I don't know. I know we touched a little bit on the brain part, but can you tell me again about the neurotransmitters a little bit?
Yeah, so those bacteria are making your neurotransmitters, your dopamine, your GABA, your serotonin, you know, all your relaxing, happy hormones. And so one of the top three things we look for when we're trying to think, does somebody maybe have a gluten sensitivity or a celiac, is depression and anxiety. So you wouldn't, you know, you think, oh, we're looking for digestive symptoms. And that's not one of the top things I'm always looking for, because I'm looking for, has the production of serotonin, dopamine and GABA and all of those, has that been compromised? Because that has a direct impact on how someone is feeling every day. The brain fog, when we didn't talk about leaky gut yet, but again, when we get food into that large intestine that hasn't been broken down into those little individual components that can be used, then they can attach to the side of the small intestine. And when they get pulled off, they can make little holes. They can also cause inflammation that push apart, and the cells should fit together, just like my knuckles. Mm-hmm. When they get pushed apart, then food particles start to go through from the inside of the small intestine out into the blood. And again, that's where the immune system comes in, has to tag it, inflammation, inflammation, inflammation. And that process not only impedes the absorption, but causes something called endotoxins. So the body's, like you think of pus, when there's a cut, it's almost like an endotoxin, right? You've got all this gross pus, but that's your body's immune system trying to kill whatever's there. So in addition to not being able to have your serotonin and all your neurotransmitter production, and then how you're feeling, now we have all these toxins that your liver has to clean up. So the liver is now getting tired. And whenever we see that compromised barrier in the gut lining, we suspect there's a compromised barrier in our brain, blood-brain barrier. And that blood-brain barrier is really important in deciding what gets access to our brain and what doesn't. So what has to, protects the toxins from getting in. But when we start that process that causes that leaky gut, also often compromises the blood-brain barrier. So now we've got toxins being produced, even just possibly from this whole process, now getting into the brain. Now we got the brain fog and fatigue and the memory. And now our brain, which is our main signaling system, can be impacting our organs that are making hormones. Now we're seeing hormone imbalances. So this domino effect. And vice versa. We know from studies when someone has a brain trauma, within the matter of hours, they can be developing IBS and their digestive function gets compromised. So this is a two-way street.
Okay.
Chronic stress can really compromise your ability to make that stomach acid and break down those proteins. So the people who are relying tons on caffeine, that can really affect our cortisol levels, which affects our stress, which affects, again, the digestive tract. So yes.
True domino effect, like from one end or the other, whether it's, from the brain having trauma or the gut having trauma. And I mean, if you think about it, as much as we eat and drink and, and the stress factor as well, our bodies are quite amazing. It's almost like we want to take care of it. We want to put it, but some people just didn't even know that this was actually going on. So I love that we're having this conversation because some people just don't know, and they don't look at their health, their immune system, their wellness as something that they can actually participate in, or they have been participating in the lack of it, and their joy factor in life, and it does spark this conversation that I love, that people will start paying attention maybe to their bowel movements and to being gentle to their gut and really wanting to balance out the nutrients, because we want to get the toxins out and good food in, keep toxins out of our food, our thoughts, and our mind as well, right? Because of the stress level does affect, like you just said, with the acid levels. So it's very, very interesting that this isn't more of a common conversation in the health and wellness, or when you go to a doctor's office, or, we've been talking a lot about this this week, about the shift from the sick care to the health care. And we as individuals taking responsibility and being our own advocates and being responsible for the state of our health, the state of our gut, and our mind. And so you're really giving us information to empower us.
Well, it's interesting you say that, because I was just thinking last night about the majority of countries in this world are much more integrated in what we typically think of as Western medicine and holistic medicine, right? The majority of countries, those two systems are closer together and collaborate much more than we do here, for whatever reason. Our physicians don't get training in nutrition, and if they do, it is so minimal. And they will admit that. They don't have the time to spend with people really healing back lifestyle changes and working that through with someone. I always joke with my patients, you're not paying me to tell you that broccoli is healthy and the McDonald's isn't. You've got that covered. It's how, given all the things going on in your life, can I help you stopping at McDonald's every day and start eating broccoli every day? That's what you're paying me for. And that's what we do. But doctors don't have time for that. Not in the insurance model that they're all in. And so, unfortunately, it is a mind shift for the user, the patient, to recognize where does one medical system shine and where does the other shine, and how do I navigate both? I'm married to a physician. I'm a huge advocate of Western medicine. Look at what they're doing right now with Corona, heroic measures, and that's where they're phenomenal, right? Would we be right now without these angels of doctors and nurses who are saving lives and putting their own lives at risk, right? Heroic measures. But that system isn't designed to sit for an hour with someone and really understand what does their day look like from when they wake up till they go to bed, and where are those stress points, and where are the food sensitivities, and how can we get a working mom to incorporate healthy foods without overwhelming her, and to just all of these pieces of how do you change what's going into your mouth and get you back to being more present in your day, so all of these systems can balance out and heal, right? And that's what we do. And we use some diagnostic tools along the way to help point us in the right direction of herbs and supplements and foods.
And you're educating along the way. So you're bringing the awareness, and you know, Neda, how I feel about the awareness, education, access, and really delivering this to our community. And I think once people are aware, they get the education, then they have access to it. I think people really want to do well. It's just so, you know, if they need that guidance.
Mm-hmm.
And like, even for me, when I switched all over to organic and vegan, I got some pushback by the family. It's like, what? You're not going to buy goldfish anymore? You know what I mean? Because I don't know, they had whole grain goldfish years ago. And I thought, okay, that's a healthier option. Not looking at the additives, I knew they gave me migraines, so I never ate them. You know what I mean? But it's a staple for people, and they think, oh, this says organic, which may mean it has an organic ingredient in it. But it's just an education level. And so you're right, doctors don't have that time. They're all, you know, for when people are sick, that's why they go to a doctor. What your focus and what the community's focus is with the holistic community is to keep people from having to go see the doctor and to live a really, you know, vibrant life that is healthy and without disease long term, right?
Well, their system is set up on coding. They're looking for, what code do I put on this chart so they can get paid for their amazing work that they're doing, right? But the codes are aligned with illness. So there is no code for not eating enough broccoli, or there's no code for, you know, tension in marriage. You know, and that's the stuff we're working on. And so, because those are that's where the magic happens. It's helping someone make just sometimes little shifts, right? And spending the time to listen to find out, well, where are those opportunities that this person actually can do. We're not trying to stress people out or tax them. We're trying to take some of that off for them. And it's a lot of listening and really diving into their world, meeting them where they are, figuring out what's going on in this microbiome. What does this microbiome need? Okay, how can we help this person give their microbiome what it needs, so that then they have more energy to do even more things, and then the positive snowball happens.
Positive snowball, I love that.
Right, the positive snowball. And there are times we say, hey, can you check in with your physician for this? And we have a lot of patients who then cringe and say, oh, I can't tell my doctor we're seeing you. And I say, okay, then that's a problem. Then would you be willing to see this doctor? Because this is an amazing MD who won't criticize you or judge you, will actually honor the work you're doing here. And that's key, is making sure you do have that Western medicine team in place that supports and not poo-poos or rolls their eyes. And that's what I mean, in this country, it's very unique. You don't have docs in other countries, for the most part, rolling their eyes and making sarcastic comments about this type of work. And I don't know why it had to be an us versus them, because we're all just trying to help people be healthy, you know?
Exactly.
So finding clinicians in the Western model who do support that. I don't know if you found that. You did when you were going through your cancer journey. You found some doctors.
Oh yes, I searched until I did. Yeah.
Right.
And a fabulous doctor, and you know, completely supported me doing a, you know, healing journey to, you know, heal the emotional wounds, because usually a lot of physical ailments will have an unresolved emotional tie to it, you know. So the emotional health goes really hand in hand along with the gut health, the, you know, spiritual health, all of that. And it truly is a well balanced way. And he respected that, and I respected what he asked me to do, and we worked together, you know, and I still work together with him to make sure that we're there, you know. And what I love in our conversation before, you talked about the biome, we talked about getting the testing, and now when we're making adjustments, what does that look like? Because, you know, Neda is going to clear out the, you know, with the what is it, the
Colon hydrotherapy.
Yes, the colon hydrotherapy, but it's also called the colonic, correct?
Colonics.
Yes,
Correct.
colonics. And so we clear that out, and now it's time we're going to make these adjustments in our life. We see we have these test results. So what does that look like? Because a lot of people are afraid of change. Obviously, you know, we were thrown into this change right now that we're living in, right, with the pandemic and, you know, at stay at home. But the same response comes to people when they say, "What, you want me to eat more of a plant-based diet?" You know, so how do you guys transition people? Because I know you have a lot of success stories. So whatever you're doing is working. So share how you do that transition.
I think our entire team, we've drilled it. You just meet with whatever individual you're working with, you meet them where they are, and you just take that next best step. That's from Frozen, Frozen 2. I think Anna, just take do the next right thing.
Do the next right thing. Yeah.
And so they're doable, and so people can get success under their belt. And there's usually supplements that will help feed an organ and support an organ. And so real food-based supplements. There may be some herbal supplements that direct an organ to do something, or herbal supplements to address an infection. Or we may use food as a medicine to feed certain bacteria that are deficient, certain types of fiber powders or vitamin mixes that, you know, people can drink. So in addition to, you know, and it may be, do you work in a building that has a staircase? Can you set an alarm on your phone every hour and just go climb the staircase, you know, and just go back to your desk? That may be a starting point if you're not exercising. Mm-hmm. And so we really just try, like, well, what is doable in your life? That is what the last thing we want to do is stress people out. Because it's a little, and if your microbiome's already really imbalanced and you have an infection, your body's already stressed. We don't want to add to that.
Right. So you're gentle and you meet people where they are, and you help make small decisions which eventually create such great change. And
unless you have that person saying, I want it all and I want it now and I want to do it tomorrow, I can do that. That's great.
Right.
The gold standard. This is what I want you to go do. And I have people who will do that. And that's great.
You gotta love that, right?
But they may be in a different position. Maybe it's a stay-at-home mom whose kids are off in college and she hasn't returned to work and has time for that, or somebody who's recently retired, or you never know what people's lifestyle is, that they have room for that. But
okay. That's great. And so anything else that you guys want to share with us? I mean, you've covered so much, and I love the shift that we're taking here into really educating people. And you guys have the ability to even see people now through the telemedicine format that you have. So I'll share your website. Is that the best way to contact you? Because your phone number and everything is there. And they can make an appointment to see you guys or to ask more questions. Anything else, Neda, you might want to add?
No, the best way right now is absolutely read about us on our website. Unfortunately, our phone system goes directly into voicemail, but that phone number, you can text us. That will give me the heads up to give you a call. So that is the best way to go about it, and we can figure out what is the best, appointment for you, or we could discuss what's going on with you so we could figure out the proper plan for you. And I guess the biggest thing that I want to just stress about all the things that Dana said, because she did say a lot of fabulous things today, is just going back to the, you know, if you are not feeling well, you would never do this to your child. If they're not feeling well, you wouldn't send them out to school, right? You wouldn't want them to be to expose their you know, their cold to somebody else, or and so forth. So the same thing with what's going on, right? You know, with same thing with what's going on with the coronavirus. If you don't know what's going on internally right now, and even when just by going food shopping, and you know, everyone is so fearful of all the things that can happen right now, and what am I touching, and what can I pick up, and you know, the social distancing and so forth that we have put into place. If we don't know what's going on internally with us, it's going to be very difficult for when the doors do open and we are put back out into the universe and going about our day. We want to make sure that our immune system is strong enough to be able to handle it. So this is a great way to see what's going on internally. Can your health handle what's going on around us right now? And not to say that you can't get the coronavirus, but maybe the severity of it won't be as dire, and maybe your body can handle, your immune system can handle it a little bit better. So I just wanted to put that, the importance of that out there.
No, I appreciate that. That is so important, because the viruses aren't going away. There's always a different virus that's going to pop up, a different illness. And so the immune system, and knowing that you're doing the best you can with your body, and the testing that you guys have is so individualized. It's not a one size fits all. I mean, you're really looking at each person's individual state of their health, state of their organs, their immune system, all of that, and addressing it individually. So there isn't just like, oh, go take zinc, you'll be okay. Go take this or that, you'll be okay. It's bigger than that. And it's more empowering, because it's so inclusive. And if it's not the corona, there are always viruses out there. I mean, we need to be equipped. And I love that you guys, you know, have your facility and your knowledge and your skills and experience, and the testing and the supplements, everything to truly you know, give us our bodies what we need.
Just, you know, Neda, you made me think of this. I meant to say this earlier. And again, this isn't based on anything other than Dana just, you know, daydreaming about microbiomes, which I do often. And the immune marker that we see on this microbiome test, we still have no idea why some people die and some people barely have any symptoms, right? We don't know yet with this disease. And I still in the back of my mind go, gosh, I would love to have had a stool test on these individuals and see, because I can't help but wonder, you know, I can see if someone's immune system is offline, so to speak, or struggling or deficient on these stool tests. And I keep thinking, are those the folks that are ending up in the hospital on respirators? I don't know. But I keep wondering that and wanting to have that data, and you know, that's
to be able to study that. Right.
But, yeah.
So let's say I wanted to go ahead and get a stool test drop shipped to me, right? Because I can't come see you guys. I just follow the website, give you a call, text you, whatever it is, and just say, okay, let's set up an account. I want to go ahead and you know, get this test.
Yeah.
Is it that simple?
Well, we do start off with always doing an initial health history, because that's really important to know what's going on with your health from time of birth till now. And to know that information allows us, or the practitioners, to be able to analyze the information that also comes back once we do the stool test. So that
helps us decide which stool test would be best for that person.
Correct. So that initial health history will identify what are the proper testing for you, what's the path we want to take with you, based on what's been going on with you and what your symptoms are and what you're experiencing and what your goal is. Your ultimate goal, of course, is important too, because you may turn around and say, you know, just as an example, my goal is weight loss, and our goal may be just to look at your microbiome, and we want to make sure the two really match with one another, and that we're really helping you achieve what you're coming in for. as well. So we do always start off with an initial health history to assess. And then from that assessment, the stool test or whatever the testing is will be drop shipped to you. And once we receive the results, we will have a review appointment to go over and individualize the protocol for you.
Okay, perfect. So is that assessment done like an online questionnaire, or is it over the phone?
We send a form to you that's 15 minutes to fill out, but the assessment is an appointment that's an hour long that we spend with you to go over your entire health history.